Welcome to Forum 360 with a global outlook and a local view. I'm Ardith Keck and I'm your host today. And now that the election is over, we can concentrate on a topic that we've heard many times during the election season, healthcare. We'll be hearing about it forever since we don't have universal healthcare in this country. To talk about all of this is the executive director of an organization which would like to have health care for all. She is Rachel DeGolia, and the organization is UHCAN, UHCAN, which stands for Universal Healthcare Action Network. And we're going to be using UHCAN because it's a lot shorter. Rachel, how long has UHCAN been around?
Oh my goodness. 28 years.
28 years.
Mm-hmm.
And you have achieved some of your goals. And what would that be?
Well, I think, in the beginning, because we were formed during the very beginning of the first Clinton administration, and some of us thought universal health care was right around the corner, but it didn't come to be, right? And we came to understand that really the role we could play was to help connect and strengthen what we call the healthcare justice movement. All those wonderful grassroots activists out there working in lots of different kinds of organizations for healthcare justice, and universal healthcare, of course, is at the heart of that.
And what hopes do you have for the future?
Well, first of all, I know you said the election is over, but it's not quite over yet. And we'll be talking about that on our national call tomorrow, which, when I know we're taking this earlier before it's going to show, but until the runoffs are over in Georgia, the election's not really over yet, and that'll be in January, right? So, but I think our hopes are that the new administration, the Biden-Harris administration, can undo some of the damage that has been done over the last 4 years, and that there'll be some cooperation from Congress in helping make that happen.
And what would be your ideal?
Our ideal? Well, I think we look at movement building as our main goal, our main role. And so nowadays, healthcare continues to be a really top issue for lots of folks, but the intersections with lots of other social justice struggles have become so much more apparent than they even were when we were founded nearly 30 years ago. So our hope is that first, what's the top healthcare issue right now? The pandemic. This new administration, we have to deal with that in a way that respects science, listen to the scientists, and start turning around this horrible crisis that we're getting into deeper and deeper. And in the process of doing that, I think the fault lines, the failures of our current healthcare system have become even more stark in terms of all the people that are left out, in terms of the racial inequities and the disparities, the racial injustice baked into the system. So these are things we hope that through the lens of this pandemic response, which will be the top priority of this new administration, I think, we will begin to address some of those. And that can move us closer to getting the kind of universal healthcare system we need.
And why is it that we don't have universal healthcare in this country? Major question, right?
Oh, yeah. Well, initially it was an accident of history in terms of how World War II businesses couldn't raise what they paid people, but they could give them benefits such as health insurance. And we became dependent on a system of most people getting their health insurance via their job, those who had jobs, right? But since that time, and we've seen so many other countries figure out how to do universal healthcare one way or the other, and there are a number of different ways to do it, our system of privately provided health insurance on a profit motive has become further entrenched. at the same time as the public insurance programs we have, like Medicaid and Medicare, more and more people have become to depend on them. So I think the short answer to that question might be follow the money. Where's the money being made, right? And that's still a big question right now when we're looking at how the response is going to be to this pandemic and the development of this new vaccine we're going to need. There's huge amounts of money being spent and being made, and not necessarily all for the public good. And the public monies are sometimes being siphoned off for private entities in a way that is really inappropriate.
And I understand the lobbyists are huge against universal health care.
And that's been, I mean, I think huge amounts of money have been spent making sure that the system we have, which is really a non-system, stays in place. But given how many people have lost jobs and therefore lost their insurance and are getting sick or worried about getting sick, we have a shared experience now because of this pandemic about what it really means to be without health care and how many people are experiencing that. And so we're hopeful that out of, this horrible situation we're in, there will come more of a commitment on a national level to solving the problem and establishing something like Medicare for All, which of course has been the gold standard out there that lots of groups have been advocating for a long time. In fact, there's a bill that was introduced back in April for basically emergency Medicare for the duration of the pandemic to help make sure everybody who got sick had access to care.
What happened to the bill?
Nothing. It was introduced by Senator Sanders in the Senate and Representative Jayapal in the House. And, given the stalemate in Congress, it hasn't passed.
It's sitting there.
It's sitting there. Right.
We are the only industrialized country in the world without universal health care. And to me, that's shocking. Shame on us.
Yeah, I agree.
I knew you would. You mentioned Medicare for All. Can you talk to me about what they mean by Medicare for All?
Well, it uses, the concept is that the way we pay for Medicare now through payroll tax would fund coverage for people, and providers would be private or public, depending, like a lot of people have private providers and don't get their, the VA is an example of national health insurance, where the government actually owns and runs the hospitals and pays the doctors directly for the care that the veterans get. But Medicare for All, there's different ways it could be done. They do it up in Canada, but it's basically taking funding across the board out of based on income to put money into a pot that will cover health care for everybody, instead of leaving it up to whether people can afford it, or whether they get it depends on whether they can afford it.
President-elect Joe Biden talks about the public option. What is the public option?
Well, that concept was out there, and actually part of the original Affordable Care Act, Obamacare, in the beginning. And the idea was that there would be a public health insurance option for people that would actually compete with private health insurance plans, and hopefully help bring the prices down. And it would be available to people, as an option to choose for covering their healthcare needs. So this is something he's been promoting. It still involves depending on private insurance companies to be the middleman, so to speak, to provide healthcare, to make sure people get access to the healthcare services they need.
But it would be cheaper?
Well, that's the concept if it's organized properly, and it would help bring down, by competing with the private companies, it would help bring down some of the costs.
Okay. The Supreme Court is currently hearing a case involving getting rid of Obamacare,
Yeah.
which the Trump administration has been trying to do. What's happening there?
Yeah, and a lot of senators have been trying to do that for a long time. I think there were over 60 votes to repeal the Affordable Care Act in the last 4 years, something like that. Well, we just had the hearing where we heard the arguments, and it seems that the justices that there may not be a majority to throw out the Affordable Care Act. It would be pretty incredible if they did. It would create incredible chaos in the middle of a pandemic, no less. I mean, their decision could come as early as March. You know, I think generally they expect the decision sometime between March and June of 2021. And to throw out all those millions of people that have their health care through the Affordable Care Act. And mind you, it's not just the privately insured people that have gone on the marketplace to buy insurance, but it's also all the people who've gotten Medicaid under the Medicaid expansion, which has been a huge help for people. And that would be thrown out immediately as well if they throw out the case. So based on what we heard the line of questioning, we're not as pessimistic about that. But of course, we won't know until they make their ruling.
Right. And the pandemic has, and I think you mentioned this, taken away health care for many people. Why?
Well, if you have health care through your job and you lose your job, there goes your health care. And if you were a part of the gig economy and you didn't have healthcare through your job, but you made enough money to purchase a plan individually and you lost your job, there goes your healthcare. It's really very backward to have health insurance tied to whether or not someone has a job. It's really backward. We need, healthcare is a right. Healthcare is what everybody needs, healthcare to have a healthy population, to be able to support all the healthcare institutions we all need to rely on in emergencies or when there's things happening like the pandemic. They need to be able to count on being reimbursed for the services they provide. And right now we have people getting sick with COVID-19, often who aren't insured and who are incredibly running up huge bills. Bankruptcy even with the Affordable Care Act, bankruptcy has, medical debt has continued to be one of the main drivers of personal bankruptcy. That's unconscionable.
Yeah, that is a shame. We're talking about healthcare today, and this is Forum 360 with a global outlook and a local view. My guest is Rachel DeGolia, who is the executive director of an organization called UHCAN, which is Universal Healthcare for Action Network. What has the Affordable Care Act, or as Obamacare, as it's come to be known, provided for people?
Well, I think for millions of people, it provided access to private health insurance that they otherwise couldn't get. And it has protected people from being denied coverage for pre-existing conditions. That's probably one of the most popular provisions of it. Another really popular provision is allowing parents to keep their children on their coverage until the age of 26. That's been huge as well. And it has eliminated a lot of the inequities in terms of coverage for women. I mean, before the ACA, pregnancy was a pre-existing condition that could cause someone to be denied health insurance. Isn't that lovely? That just as an example. And then it provided an expanded federal funding for states to provide Medicaid for people that's public coverage up to a higher income level. Up to like I think for a family of four was maybe around $24,000, $25,000 a year, which is still pretty low. It's hard for a family of four to live on that. So it has, and then on a bigger level, it actually helped change the whole national conversation. And I think has created an expectation that yes, government should help make sure everybody has health care. And that's probably one of its biggest achievements.
Mm-hmm.
And it put a lot more money into public health, a lot of which got cut over the last 4 years, which is, we're suffering the consequences of that now in trying to fight this pandemic.
Yes, yes. As an employer, has the Affordable Care Act or Obamacare been a happy case for them? Have they needed to pay more or something like that? I know I have a friend who owns a small company and pays health insurance for about 6 employees. And she claims that she pays through the roof as a result of the Affordable Care Act. Is that on your radar?
Well, she was probably paying through the roof if she was paying for it before the Affordable Care Act as well. The prices haven't come down enough, obviously. There's still, but there's ceilings on what people have to pay and what people individually have in terms of out-of-pocket maximums for the year and so on. The Affordable Care Act was a big step in the right direction. It wasn't the whole enchilada of what we needed, right? But it was a big step in the right direction.
Which we don't know about right now. Are there other organizations like yours?
Well, UCAN's pretty unique because we play a role of bringing together groups working around health justice issues in a lot of different ways, multi-issue groups, single-issue groups, local grassroots groups, statewide groups, national groups. We help connect people through a national network. We run a national conference call every month, and we share information about what's happening across the board in the healthcare justice movement, the different ways folks are getting involved and trying to make a difference. We also help connect health justice groups to what's happening with other social justice movements. And that's a pretty big thing. And not a lot of folks are doing that. So I think we're pretty unique in that regard. UCAN tries to provide a safe and inclusive table for folks to talk, for activists to come together, hear what each other are thinking, and discuss what's happening. And, you know, we don't always agree on the best way to move forward. There's been a lot of disagreement, in fact. But we try to help both model and encourage groups to figure out how to work together better and not get in each other's way, you know, when they can't.
Do Americans want universal health care?
Oh, there's no question. People don't really totally have the same idea about what that means, but there's been poll after poll after poll. It all depends how you ask the question. And of course, as soon as you start asking about raising taxes, people get confused about what's involved. And you know, the argument for using taxes to pay for healthcare, it's the best way to fund healthcare for all in a way that's fair. And if it's truly replacing what people are paying out of pocket themselves for premiums and co-pays and deductibles and all the stuff that's not covered, it could save people a lot of money. But that transition scares people. You know, the devil you know is better than the devil you don't. So it's
and the government in anything is bad.
Well, unfortunately, we've seen a lot of demonizing of government. And what happens when you demonize government in this? I mean, there are some things government does better than the private sector, and vice versa. But something like healthcare, when people can die without it, or their lives can be destroyed without it, it's not like, you know, buying a better refrigerator or some kind of consumer good. I've never been one for using the term consumer when it applies to healthcare. I think we're all patients or potentially patients. So it's, you know, we still have this national discussion that we need to have about this.
And a lot of people think we have the best healthcare in the world. But the outcomes are not, for Americans, are way below other countries. If we have the best healthcare, then why are our outcomes so low?
We have the best healthcare for those who can pay for it.
Got it.
Mm-hmm.
Got it.
I'm really scared to death to learn what the mortality statistics will be. I mean, the life expectancy after this pandemic. It's, we already had problems with, opioid addictions and suicides and people, getting sick because they didn't have access to healthcare before the pandemic. And all of that is now just exacerbated.
And as you say, people losing their jobs and then losing their health care during a pandemic when they might be sick and have relatives who are sick, children who are sick.
And potentially losing their homes or their utilities being cut off because they can't afford to pay their bills. And the other side of it, what's happening in our healthcare institutions? Hospitals are getting overwhelmed all across the country. And we still have a shortage of PPE 6 months later. Why? So one of the things we really need to see happen is that a new pandemic relief bill soon, hopefully before the end of the year, and not just have to wait for a new administration for that to happen.
Are there states in the United States that have an inclusive plan for their citizens?
You mean universal health care?
Yes.
Some do a lot better than others. Because they have they fund Medicaid up to higher income levels, for example. But I don't think you can say that there's any state that is doing universal healthcare by itself. And that's a really heavy lift. This is something that has to be handled on a national level with, of course, implementation on the state level. But, I think, for example, Vermont has a very low uninsurance rate. I think the state of Hawaii, perhaps. But, these are exceptions.
And the people who have Medicare, like me,
yeah,
really like it.
Yeah.
It's a popular thing.
That's right. And unfortunately, under the Trump administration has been really pushing privatizing of Medicare big time through the Medicare Advantage plans and other ways of really potentially cutting Medicare. And that's tragic. Traditional Medicare is much more secure for people than any private HMO, Medicare Advantage plan.
And there are some states that did not option in for Medicaid for poorer people.
To expand Medicaid, right.
Yes. And Ohio did, and
yes.
It's been a very successful.
It's been huge. It's been a huge help. And a number of states since the Affordable Care Act was passed back in 2010 and have even really red states have approved Medicaid expansion via popular vote as ballot initiatives. So that's still going forward.
Okay. So there are some states that are still.
Yeah, particularly in the Southeast. Have not. Yeah, particularly in the Southeast of our country. Take a look at the states that were part of the Confederacy, really. And I think it ties in with racial injustice in terms of failure to expand Medicaid and to see the importance of having a program like this that covers everybody.
And if a state does not accept Medicaid, what do those poor people do?
Well, every state has Medicaid, but some of them have it only up to, say, 90% of the federal poverty level instead of, 130% or whatever it might be under the Affordable Care Act. So you have to be awfully poor to have access to Medicaid in some states. So poor that you're probably homeless.
And what does UCAN propose to do about drug costs?
Oh, well, we aren't policy people. We aren't putting forward policy proposals, but we work with a lot of groups that are looking at that. And there are a lot of groups that are looking at the high cost drug problem. And right now we're facing a shortage on insulin, for example, and people not being able to afford insulin to take care of their diabetes. So we have a real serious problem in this country with the cost of drugs and absolutely no cost controls that can help bring those down. despite the promises of the Trump administration to do so. The Veterans Administration is allowed to negotiate for the cost of drugs with drug companies. Medicare was prohibited from doing so when they put prescription drug coverage into Medicare. That's ridiculous. If Medicare could negotiate for the cost of drugs, that would really help bring the cost of drugs down for everybody.
That tells you where the lobbyists are.
Oh, yeah.
Okay.
Mm-hmm.
Some of these same problems are ones we discussed way back in the 1990s. And so in some instances, not much has changed. The Affordable Care Act came in, and that has helped. Thank you, Rachel, for joining us, and to UCAN for all your attempts to get universal health care for our citizens in the United States. This is Ardith Keck for Forum 360 with a global outlook and a local view.
Thank you.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.